In 1925, the American Academy of Speech Correction was formed, which eventually became the American Speech-Language Hearing Association, and speech pathology started to gain some recognition in the US. Back then, speech therapists primarily focused on speech sounds, or elocution, and started to expand into cognition and language therapy as soldiers were returning home from World War II with brain injuries. Fast forward to today, nearly 100 years later, and the field of speech-language pathology has expanded a lot, to the point where many of us discuss two types of SLPs, school SLPs and medical SLPs. Some universities are even offering core and medical speech pathology tracks to their graduate programs so students can tailor their education to fit their desired career path. However, that's not the norm, and many SLPs, including myself, have found themselves overwhelmed and unprepared to safely serve the medically complex populations when they start working as a Med SLP. This has led me to create podcasts, a medical SLP membership program, continuing education opportunities, and most recently, a medical SLP certification program. Stick around to learn why and how I created a Med SLP certification program, what it all means, and what I've learned in the process. Let's dive in. I'm Teresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the Med SLP Collective and Med SLP Education. Number 1. The need for more extensive medical education for medical SLPs. As a medical SLP feeling lost and deserted out on Dysphagia Island for many years, I never had any idea that my career would go in the direction it has. When I began writing blogs and started the Swallow Your Pride podcast, it was really honestly for myself. I was craving more knowledge in medical areas that I really didn't know much about, nor did I think it was fair to my patients to not be as strong in those areas as other medical professionals. I found myself really stuck and almost sad when I realized that other SLPs had incredible medical training, and I didn't. So I did what I needed to do and sought out conversations with other SLPs and mentors to begin figuring out what I needed and how to get that training. When the Swallow Your Pride podcast really started to gain popularity, I knew there was a need for a lot more education out there that just really didn't exist. The Medical SLP Collective was the answer to a lot of those questions, but it exposed an even bigger gap. How the heck do we really get SLPs the extensive medical knowledge that is needed to work in some of these fast-paced, medically complex facilities? How do we get our veteran SLPs that have been working on the field for years and years up to date with the medical knowledge and our scope of practice that is rapidly changing and evolving? And how do we meet the needs of SLPs that maybe went to a pediatric-focused grad program, or they've worked in the schools for years and years, but are wanting to make a career change, and they want a place where they can go to take an extensive amount of courses, combined with direct mentorship that many SLPs are seeking? So Med SLP Education was born. This is a new company and a new platform that was created to fill that need for those that were seeking it, and it provides a new set of ways to learn medically intensive SLP information. Here's how. If you're looking for webinars and continuing education specific to medical SLPs, you can purchase individual courses from the Med SLP Ed library a la carte style. Each course is at minimum 8 hours long, some are even longer. Each course is a combination of intensive medical education and case-based learning, so you're not left wondering how to apply what you've just learned. If there are multiple courses dedicated to a specific topic that you're interested in learning from, you can purchase a bundle deal. For example, if you want to take all 3 courses we have dedicated to the upper airway and respiratory system, as they relate to your work as a medical SLP, you can purchase the upper airway and respiratory bundle for a discount and enjoy the 24 hours of medically intensive learning you're about to do. Finally, if you're looking for an entire year of education, like over 200 hours of medically intensive SLP education with case studies, an assigned mentor, a cohort, weekly group mentor calls, and a comprehensive exam to assess your knowledge, then Med SLP Ed also offers a certification program. Med SLP Ed is a place where SLPs can explore in-depth learning opportunities, as well as an opportunity for greater support, mentorship, and a certification to showcase their medically focused education, should this feel like the right choice for them. Not all SLPs need additional extensive education, and the Med SLP education certification isn't necessary to be a Med SLP. But for those of us who never received the education and support to set us up for success in a medical setting, Med SLP Ed is an option available to you. Number 2, what even makes up a certification? Did you know that there are over 600 options for certificate programs and certifications for SLPs? And remember, none of them are necessary at all in order for SLPs to work. So why would anyone even consider certifications? Some SLPs may want more specialized training in order to help a specific population, or maybe you're just a nerd like me who loves to learn. Now, there are different options out there, such as certificates, certificate programs, and actual certifications, all that meet different needs and have different standards. According to the Institute for Credentialing Excellence, ICE, professional certification programs and assessment-based certificate programs serve different purposes and may require separate business approaches, governance structures, and development processes. ICE is helpful in determining the right type of program and can help to evaluate the program's goals, purpose, assessment, and maintenance requirements and identify the correct program path to meet those needs. According to ICE, there is no superior program type, just the right program. The purpose of a certificate is to provide instruction and training and build capacity and recognition of a specialty area of practice or set of skills. A certificate recognizes mastery of the specific learning outcomes, whereas a certification assesses knowledge, skills, and/or competencies previously acquired and recognizes professionals who meet established knowledge, skills, or competencies, and awards designations to recognize achievement. We decided if we were going to invest in building this platform, then we might as well go all the way and create a certification. There are plenty of certifications out in the world that do not have an accrediting body behind them, and there's no requirement for certifications to be accredited. But of course, that helps with credibility and just keeping the program as robust and reputable as it was originally intended. In speaking with other credentialing agencies and organizations, we decided to go with NCCA, which is an accrediting body that credentials many other medical certifications and maintains extremely high standards, which is why we thought this would be the perfect agency for this program. In 1977, in cooperation with the federal government, the National Commission for Health Certifying Agencies, NCHCA, was formed to develop standards of excellence for voluntary certification programs in healthcare. In 1989, the name was changed to the National Commission for Certifying Agencies, NCCA, to accommodate all professions and industries. The NCCA's standards for the accreditation of certification programs were the first standards developed by the credentialing industry for professional certification programs. The NCCA standards were developed to help ensure the health, welfare, and safety of the public. The NCCA uses a peer review process to establish accreditation standards, evaluate compliance with these standards, recognize programs that demonstrate compliance, monitor and enforce continued compliance, and serve as a resource on quality certification. They highlight the essential elements of a high-quality program. The NCCA standards are consistent with the standards for educational and psychological testing and are applicable to all professions and industries. NCCA accredited programs certify individuals in a wide range of professions and occupations, including nurses, physicians, respiratory therapists, counselors, and more. To date, NCCA has accredited more than 315 programs from more than 130 organizations. And this is why we've decided to pursue accreditation through NCCA. Well, that felt like a mouthful. Learning about certifications this much in depth was definitely not something I ever thought I would invest so much time in learning about. Now that we are underway with getting the Med SLP Education Certification Program accredited with the NCCA, we are about 6 to 18 months out from getting accredited. Just as grad programs have to run their curriculums for a few semesters before they are able to apply for accreditation, and the same way companies that want to apply to provide ASHA CEUs, the same applies to certifications. A few iterations have to be run first to ensure that all of the proper procedures are in place and running before the application can be submitted. So I'm excited to announce that we are well on our way. I will be posting other videos just like this one that you won't want to miss. So make sure to hit that like and subscribe button and turn on the notification bell. Do you have any specific questions about the Med SLP certification? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Number 3, mentorship. If you scour any of the online groups or forums for Med SLPs, you're bound to come across a post or comments of SLPs encouraging their colleagues to find a mentor or SLPs looking for one-on-one mentorship. Sometimes it's because they're the only SLP in their facility, and other times it's because they knew they needed more medical knowledge and were hoping that a mentor might be able to help them identify their gaps. Regardless of the reasoning, we knew we wanted to provide a professional mentorship program. On top of the courses that were created for the Med SLP Ed Certification Program, we decided to include one-on-one support for every participant and also weekly group calls facilitated by the mentors to discuss tough clinical cases. The mentors that came on board to the Med SLP Education Certification Program came highly recommended by others in the field, have years of experience mentoring other SLPs, and have extensive clinical or teaching experience. As I said before, I had no idea that my career would take the turn that it has, but my vision for improving education in this field has never been so clear. I also recently enrolled in a PhD program, and I'm doing a track in curriculum development because I want to have the formal education to be able to teach and successfully implement formal education for medical SLPs. That is quite a meta mouthful. If you're wanting to learn more about the Med SLP Certification Program or to check out any of the Med SLP education courses, head over to medslped.com/certification, and the link will be in the description below.